Hi everyone and good evening. Welcome to another webinar by Plant-Based Health Professionals UK. For those of you who haven't met me before, my name is Rohini Bajekal and I'm Head of Communications at Plant-Based Health Professionals UK, as well as a nutritionist. And tonight we're going to be joined by Dr. Tila Kansagra, who's a board-certified lifestyle medicine physician and practicing GP. And she has an extended role in chronic fatigue syndrome. Before we get started, I just want to remind you of a few webinars that we have coming up over the next few months, as well as our new VegMed conference. So just bear with me for a second. So the next webinar we have in a couple of weeks' time is with Anita Bean, who's actually got a background as a professional athlete. She's a registered nutritionist and best-selling author. And this is going to be all about plant-based diets for optimal health and performance, learn how to fuel your workouts and your training schedules. And this one is great for anyone in your life who might be skeptical about how to thrive on a plant-based diet when you're training for performance. We also are going to be joined by Wendy and Carlijn, who are based in the Netherlands, for a great webinar on plants for joints, which is going to talk about their two research studies in this area. So this is brilliant for anyone who is looking after patients with joint issues, osteoarthritis, or different kind of joint related and autoimmune related issues. So please do join this free webinar. As mentioned, all our webinars are free, CPD and CME accredited, and recordings are available for PBHP members and go up on our site a few days later. You'll also receive a copy of the slides and a certificate in your inbox in a few days' time. Do also join us in September on the 9th and 10th of September at Imperial College London, where we've recently announced tickets for VegMed London in partnership with PAN and ProVeg International. This is Europe's largest plant-based healthcare conference, and I was lucky enough to attend in 2019. It's the first time that this conference is back in person, and it's in London this time. So we're really excited to be organising it at Plant-Based Health Professionals UK. We've got an amazing lineup of speakers, including the wonderful Brenda Davis, who'll be joining us virtually, Tammy Tong from the Epic Oxford study, and many more. So do go on to vegmed.org and get your early bed tickets, which are only available until June 14th, as this is going to be an incredible weekend that's packed with talks, interactive sessions, and networking. And lastly, a thank you to our sponsors, including veganfitness.com, for kindly lending us their Zoom platform, and the support from the American College of Lifestyle Medicine and the British Society of Lifestyle Medicine, who provide us with CPD and CME accreditation. Plant-Based Health Professionals UK is a community interest group dedicated to promoting the benefits of a sustainable and healthy whole food plant-based diet. One of the best ways of supporting us is by joining us as a member. This is as little as £25 a year for general membership and goes directly towards our advocacy work, ensuring that more people are aware of the benefits of plant-based diets for the prevention, management, and treatment of common chronic diseases. And we also have weekly newsletters. If you enjoyed this webinar, do consider donating a small amount via pbhp.uk/donate, and follow us on Facebook, Instagram, and Twitter, where we're sharing lots of the latest research, as well as details of our upcoming events and VegMed conference as well. So now I'd like to welcome Dr. Tila Kansagra to present on chronic fatigue. This is a topic I've wanted to cover for such a long time, as it spans so many different wide-ranging conditions and is actually a huge topic to cover. So really excited to have Tila, because she's such a compassionate voice in this space. She's working with patients every day who are dealing with fatigue due to a variety of conditions, and we're going to really understand what it is and what are the tips out there that you can use with your clients or with yourself, and also Tila's personal story as well. And then we're going to be joined by her for a live Q&A after the presentation, so please stick around for that. And yeah, I'll see you in a little bit, and good luck, Tila.
Thank you. Thanks, Rohini, for the lovely introduction. So I work for the Chronic Fatigue Syndrome Service in Hertfordshire, but I don't only deal with chronic fatigue syndrome. So I work as a GP, so we see people that are fatigued for various reasons. And also, we get lots of referrals, and patients don't necessarily have chronic fatigue syndrome, and that's what I'm going to go through today. I apologize, I am quite nervous, so if there's a bit of umming, but as Rohini says, I'm really passionate about this topic, and it's such a vast topic that I won't be able to cover everything, but I will try my best. So the objectives of this talk is to understand how common fatigue is as a presenting complaint in primary care and what common conditions cause fatigue. We'll identify how plant-based diets can improve common chronic conditions that present with fatigue. And we will outline the common nutrient deficiencies that contribute to fatigue in the standard Western diet, as well as nutrients of concerns that can come from a whole food plant-based diet. We'll finally learn how nutrient deficiencies can be addressed adequately through a plant-based diet. So what is fatigue? It's a feeling of tiredness, weakness, or lack of energy, and it can be related to other symptoms such as poor motivation, brain fog, muscle fatigue as well. The causes aren't fully understood, but it's a complex interaction between neurotransmitters, hormones, and immune function. So fatigue is really, really common. It's voted as one of the top 5 causes to consult a doctor about worldwide. And in the UK, comprises about 20% of consultations. The cost to the UK economy is vast, estimated to be between 650 million to 1 billion. And the annual loss of productivity due to fatigue is vast as well at 2.9 billion. So these are all the causes of fatigue. And as you can see, there are so many conditions that are listed here, and many I haven't listed. And I often say to my patients that the word disease, it says it on the tin, dis-ease. So obviously, if you have a chronic condition, then you may not feel well, and fatigue can be one of the symptoms. So most people don't understand what chronic fatigue syndrome is, and I certainly didn't before I started the job. So I thought it's really important to highlight what CFS is, even though that's not the main focus of this webinar. So chronic fatigue syndrome, or CFS as it's abbreviated, is also called myalgic encephalitis. ME implies that it's from a post-viral cause, so an infection has caused the symptoms. This can often be the case, and there is some overlap between COVID, long COVID, and CFS nowadays, but not everybody actually has an infective cause or trigger, but we often ask as a history whether there was any trigger to the symptoms. And there are 3 cardinal symptoms that need to be present, and it is a diagnosis of exclusion. So many conditions can cause these 3 cardinal symptoms as well, but we need to make sure it's not because of any other reason like heart disease. So the symptoms are post-exertional malaise. That means that every time you do a physical activity, with you get tired, and often the fatigue can be delayed hours later, days later even, and patients get used to living with the condition. So often it takes a long time until they see a clinician about their symptoms, and can be living with the condition for years. So our idea of somebody with CFS is someone that's bedridden. That's not necessarily the case, and people can be working but learn to pace themselves. And often patients say that I know that if I go on a night out, that I will have to pay for it for the next 2 days, and I use my energy conservatively. I know that I will only do this activity but stop the other activities because of how I'll feel. There is also brain fog, so issues with memory and cognition, and unrefreshing sleep. Often the level of activity is disproportionate to the amount of fatigue. The NICE guidelines have been revised, and they have been criticised by the BMJ and patient advocate groups. This is because they've taken away pacing as a treatment, and the focus is more on living with the condition. Actually, what's true is that CFS naturally does get better on its own. Obviously, we want to support patients and not just say, look, it will just get better, just live with it. But the focus is more medicalized as well, because the definition of how long the symptoms need to be there for has decreased from 6 months to about 6 or 3 weeks. Chronic fatigue syndrome affects 2 per 1,000 of the adult UK population, but this is an estimate, and a lot of patients don't feel heard and it goes undiagnosed. And I think this is especially true in certain ethnicities as well. Even though it's reported to affect all ethnic groups equally, I think in certain ethnic minorities, it's not recognized as a condition. It can sometimes, you can have somatic symptoms such as abdominal pain, palpitations, and that sort of thing. The peak age of, the peak age of onset is 20 to 40 years, and 76% of people with CFS tend to be female. So this is about the role of epigenetics. So only about 10% of disease is actually caused by our genes, in terms of if you have those genes, you definitely will go on and have the condition. This is, for example, eye color. If you have 2 genes from your mother, from your mom and dad, for brown eye color, that means you definitely will go on and have brown eyes. However, about 70 to 90% of our genes are merely suggestions. That means that they can be switched on and off by our lifestyle, and that term is called epigenetics. So I may be predisposed to heart disease, but it doesn't mean that I will definitely go on and have heart disease. Now, I practice lifestyle medicine, as Rohini does, and several of us do on this webinar. But lifestyle medicine was coined by Dr. Dean Ornish, who actually was inspired by other doctors such as Nathan Pritikin and T. Colin Campbell. And there are 6 key lifestyle factors that we look into, which affect our epigenetics, which is physical activity, managing stress, and in terms of our mood as well, healthy relationships, good sleep, avoiding risky substances, and healthful eating. So the reason why I focus on diet first is I often say to my patients that you wouldn't run a car without any fuel. So the same goes with our body. Often the focus within chronic fatigue syndrome is the output, but without the right input, we wouldn't be able to do, the activities that we are meaning to do, and we get stuck in this kind of vicious cycle. I also say to my patients as well, just because a condition like CFS or fibromyalgia are intangible compared to something like diabetes, lifestyle plays a key factor in all of these, including diet. Medication, although is useful, isn't a cure apart from things like bacterial infections. So it's really, really important that we pay attention to our lifestyle. So the diet that is advocated within lifestyle medicine is going towards a more whole food, plant-based diet. And this picture shows a lady in Okinawa. So there's these areas in the world that were studied in 2004 by Dan Buettner, called the blue zones, where they have the most number of centenarians with the least amount of disability. And what they found common about not only the other 5 lifestyle pillars, but these populations are eating a predominantly whole food plant-based diet, a diet which emphasizes minimal processed foods and excludes all animal products. Foods are derived from plants, whole grains, legumes, nuts, seeds, vegetables, and fruits. This is very different from a vegan diet because, Oreos and chips can also be vegan as well. And this compares to the usual standard Western diet with high intakes of refined carbohydrates, sugar, saturated and trans fats. Foods are generally highly processed and mainly derived from dairy products, red and processed meats, and ultra processed foods. So the reason why whole food plant-based diets are beneficial in so many conditions is, one of the reasons is because of fiber. So fiber is the indigestible carbohydrate that is not only good for gut motility, but we have something called a gut microbiome. So we have trillions of bacteria that live largely in our large intestine, and they are called probiotics. So I say to my patients, forget buying Yakult, you actually have them naturally in your intestine, and we need to feed them. And these probiotics feed off of prebiotics. What prebiotics is essentially is fiber. The good bacteria from eating a diversity of plant foods with fiber in them, and fiber is only found in plant foods, they produce these short chain fatty acids. And if you encourage good bacteria that produce the good short chain fatty acids, you get good outcomes. Just demonstrating how important it is, a bad bacteria from the standard Western diet called Hungertella is not only implicated in mood disorders such as anxiety and depression, but is also implicated in heart disease and increasing the risk of heart disease. And as I mentioned, only 9% of the UK population is actually meeting the government recommendations of fiber, which is 30 grams a day. If in comparison, the real cavemen were actually eating 100 grams of fiber a day. The other important thing about whole food plant-based diets is the abundance of phytochemicals. So these are the antioxidants, the vitamins, the minerals that help us with our immunity and to fight chronic disease as well. Examples, I don't know if you can see clearly, but sulforaphane in broccoli is an anti-cancer compound, curcumin in turmeric, and lycopene in tomatoes. So as cheesy as it sounds, if we eat the rainbow, we get the full benefits of all these phytochemicals. So as I mentioned, we're going to go through some cases. Now, I always say to my patients that this is not a blame game. I'm not saying that your lifestyle is terrible and this is why you've got the conditions and it's nothing else. So a whole food plant-based diet is not a panacea, but it's about stacking our cards right. And I'm a doctor. I've been qualified for 15 years, yet I didn't know what the ideal diet or lifestyle was. I only had 1 hour of nutrition training in medical school, and there's so much misinformation out there. If I don't know what to do, then how is the average person supposed to know what to do as well? Another thing I say is that we often take a lifestyle history, and I always say that we're taking a snapshot, and this is not to form any judgment about the lifestyle, but to look at ways I can give resources that could be helpful from seeing, what lifestyle factors may need to be addressed or what conditions the patient suffers from. And also another important factor is that often patients feel that they will find the one cause of their fatigue, but our body doesn't work like that. Our arm doesn't float in midair, it's connected to our torso. So the same is with fatigue. There are so many causes of fatigue, and we take a holistic approach to healthcare, which is lacking at the moment. And a lot of it is due to lack of resources and time. So case one is a patient who is male in their 60s with a BMI of 38. He previously had a BMI of over 40, but did some healthy diet changes and reduced it down to 38, has a HbA1c of 65, so is diabetic, and is awaiting weight loss injections with the endocrinology team. He doesn't have any post-exertional malaise and can walk for miles. So this is not CFS by definition. He has sleep apnea and is on CPAP, although he's wearing the mask at night. He has done a carb counting course from the diabetic education team. And he also has fatty liver disease. So how can a whole food plant-based diet affect this patient? How can it help him? So often patients don't believe that diabetes can cause fatigue, but actually a study found that fatigue is a presenting complaint in about 50% of patients with type 2 diabetes. There have been several studies that show that whole food plant-based diets are effective in treating diabetes, including one done by Dr. Neil Barnard and his team, comparing the effectiveness of a whole food plant-based diet compared to a standard diet for diabetes. A large study in several countries found that refined grain, sugar, red and processed meat increase the risk of type 2 diabetes, while whole plant foods were protective against diabetes as well. In terms of obesity, a study found that obesity is associated with objective and subjective daytime sleepiness, regardless of sleep apnea. So when you account for the sleep apnea, people who are obese tend to be more tired and have more daytime sleepiness. And the cause is not known, but there is a postulation that it's an interaction between the hypothalamic pituitary adrenal axis and inflammatory cytokines. A randomized controlled study assessing 5 different dietary patterns found that the most fat loss in the vegan group was in the vegan group at 6 months, and that tends to be because of the low calorie density of whole plant foods. Cavemen didn't measure their foods. They didn't have, and we know that calorie restriction doesn't work long term. And the beauty of a whole food plant-based diet is that the food is full of fiber and reaches the stretch receptors in the stomach far earlier than foods with a higher calorie density found in a Western style diet. A study in Korea also found that there is a strong association between phytochemical index, so the amount of phytochemicals in plants, and risk of obesity and abdominal obesity. So we have to be very sensitive when discussing obesity. So BMI is a mathematical equation. There are associations with certain chronic conditions such as diabetes and heart disease, but it's not a causation. And it's more effective at the extremes of BMI, but in the middle of the BMI ladder, that it's not as useful. Also, studies have shown that actually increase in weight may be actually a metabolic consequence of certain conditions like diabetes in susceptible individuals. And often people that have been overweight tend to go on many different diets and therefore gain weight and lose weight quite often. And this is called cycling. And the cycling in itself causes inflammation. There is a normal BMI bias amongst health professionals. They often look at an individual and see that they've got a normal BMI and assume that they've got a healthy diet. I can assure you that's not the case. And therefore, my focus in clinic and my colleagues' focus is instead on healthy habits as opposed to BMI shaming. As mentioned, conversations need to be compassionate and non-judgmental and move towards inclusive policy. Certain areas may have a BMI cutoff. We had one of above 40 and below 18 in terms of BMI as our criteria, but that has now changed. And as I said, it's an individual basis to find out what is causing the fatigue and what recommendations we can make. And this diagram just shows the effects of calorie density. So case 2 is a female in her 50s with a BMI of over 35. She has depression, hypertension, hypothyroidism, and although her fatigue started before she got COVID, the symptoms were exacerbated by it. She's on amlodipine and amitriptyline for some pain that she's having, which tends to make people drowsy and tired, and she's on thyroxine as well. So she's been fatigued for the past 6 months. She also has depression, as mentioned, and has had bereavement counseling, but no other talking therapies. She has widespread pain, which changes position and is on superficial touch, This wakes her up at night. She's having syncopal episodes and dizziness and is unable to mobilize. She had a low B12, but this has been corrected with injections. She has post-exertional shortness of breath when walking, just 10 minutes. She has hot flushes and scanty periods, but has a marina in situ. She has had a laparoscopic bypass, has lost weight, but gained some back, and told by the weight management clinic to go on a low carbohydrate diet. As you can see, her thyroid function tests aren't within range, and it looks like she's being undertreated with thyroxine. So she doesn't have chronic fatigue syndrome. There are so many things in play with her fatigue, and we'll go through each condition in turn. So this patient has a diagnosis of fibromyalgia. Now, fibromyalgia is a chronic pain syndrome, and it's associated with symptoms such as fatigue, sleep disturbance, and difficulty concentrating. Often, usually before, we used to have a criteria where we assess the pain by painful trigger sites, but that has gone now, and it tends to be pain that's usually there for a long period of time, affecting the upper torso and below the torso as well, and the sites can change, and often the pain is worse than the actual stimulus. A cause is not understood. It was before it was thought because of a psychosocial model, but actually studies have shown that there are alterations in brain areas involved in pain processing. Now, there is a lack of studies in both chronic fatigue syndrome and fibromyalgia, and that probably can be explained by the fact that there's this emphasis on a psychosocial model. And I really feel strongly about this, that more studies need to be done. The evidence is only as good as the studies that are being done. So, a lot of the conditions, as I mentioned, the larger ones like diabetes have whole food plant-based diets have been studied, but not so much in fibromyalgia and CFS. The worldwide prevalence is very similar to CFS at 2 to 3%, and again, it affects females more than males. There are limited studies of whole food plant-based diets. One of them was a raw vegan diet, which was high in lactobacilli, and it showed that there was an improvement in subjective pain scores, both from the clinician and the patient, as well as lipid profile. And people who actually went into the study had a high BMI at the start and were found to have a lower BMI at the end. There was also a meta-analysis of about 12 studies. 3 of them looked at plant-based diets and all showed an improvement in symptoms. Now, as I mentioned, these studies are quite small and are quite subjective, but again, it just highlights the fact that more needs to be done. So patient number 2 also had other conditions such as the menopause, and although HRT is useful and medication shouldn't be exclusive of lifestyle, it's not either or, but both can work synergistically. We know that if we don't improve lifestyle factors, then HRT is less likely to work, and we should be reviewing HRT every year, and it's much harder to come off it when lifestyle factors aren't addressed. Dr. Neil Barnard and his team again did a study comparing a whole food plant-based diet compared to a Western diet, a standard diet, and there was marked improvements in menopausal symptoms, not only hot flushes, on a whole food plant-based diet. They included a portion of soya, unprocessed soya such as tempeh, tofu, soya milk, soya yogurt, and edamame beans. And people worry about estrogen content in these foods, but actually the opposite is true. They contain phytoestrogens, which block the estrogen receptors and actually protect against breast cancer and prostate cancer as well. Studies in thyroid disease also showed that the high consumption of animal fats and butter was associated with autoantibodies against the thyroid receptor, and high consumptions of whole plant foods is protective. There was a study done in a population, the Adventist Health Study 2, and that population is very unique. They're a group of Christians that some are whole food plant-based, because of its health benefits, but they also have vegetarians and omnivores. So you can directly compare the effects of going more whole food plant-based on health outcomes. And they show that there was a lower prevalence of hypothyroidism in those that are more plant-based. There are effects on moods, as I mentioned before, in terms of fiber and probiotics, encouraging good ones. A study found that vegetarians had higher intake of ALA, which is found in plant foods, and a type of omega-3 essential fatty acid, compared to when it was more from animal-based sources. There is a lot of overlap between long COVID and chronic fatigue syndrome, and a 6-country study found that plant-based diets or pescatarian diets were associated with lower odds of moderate to severe COVID-19. We also know that people with metabolic risk factors such as diabetes, high blood pressure, high BMI are at more risk of worse outcomes from COVID, and so treating those can really help symptom severity from COVID as well. We do see patients with COVID, but if they have respiratory symptoms, then they're best placed within the long COVID service as opposed to our service, due to getting physiotherapy for the breathlessness symptoms. So just a quick note on omega-6 to 3 ratio. So as I mentioned, omega 3 fatty acids are essential fatty acids, which means that we have to get them from our diet. Although we need omega-6, there is a sweet ratio that we must keep to, which is 3 to 1. Our diets tend to be higher in omega-6 and lower in omega-3, and that is pro-inflammatory. And every chronic disease is based in inflammation, so it's really important to reduce inflammation. Now, omega-6 is largely found in processed foods that are using corn oils, meat and dairy, and omega-3, although the original source of omega-3 is there are short chain fatty acids and long chain fatty acids. Now, short chain fatty acids, or ALA, is found in plant foods, and this is generally walnuts and all types of seeds like flaxseed, hemp seeds, and that gets converted to the long chain fatty acids that our body uses, which is DHA and EPA. Now, the conversions rate vary among people. Although people think of fish as omega-3 sources, actually the fish is not the original source. The fish actually eat algae in the sea, and that's how they get their omega-3. So if you want to hedge your bets, then take an algae supplement in order to reduce inflammation. So case 3 is a man in his 40s with a BMI of 25, a high cholesterol of 7.5. He has anxiety, depression, and has a right ventricular aneurysm. He's on venlafaxine, and any type of medication for depression or anxiety can affect sleep cycle. He has had symptoms for 10 years and is fatigued at work, short of breath descending stairs, and because of that, he's confined to one room and goes to sleep at 3 a.m. and spends most of his time in bed. He has a low folate level of 1.8, is taking B12 supplements of his own accordance, and is on kelp supplements as well. And I will mention that later, but kelp can be quite high in iodine and could be a cause of a goiter, and I could feel his swelling. So I've asked his GP to check that out. He's on a standard Western diet, and he had some oral decay, is an ex-smoker and smokes cannabis. And this is just mentioning about weight bias. He had a normal BMI, yet had heart disease and a high cholesterol. So we have to be really careful about discussing habits as opposed to making judgments on people's BMI. Now, how can whole food plant-based diets help cardiovascular disease? There are several studies, lots and lots of studies that show that the more whole food plant-based the diet, the better the outcomes from cardiovascular disease, mainly from reducing atherosclerotic plaques from high cholesterol. This diagram actually shows a study done by Dr. Esselstyn, where he put people with severe heart disease on whole food plant-based diet, and he showed that he could put the condition into remission on angiography. There was a recent study that's been published in BBC News, showing that the more whole food plant-based diets that we have, the lower our lipid concentrations, and as a consequence of that, the less risk of cardiovascular disease. So a bit on folate. It's a natural form of vitamin B9. It helps form our DNA and is involved in protein metabolism and for healthy red blood cells. It has a key role in breaking down homocysteine, which is a pro-inflammatory molecule. It's a associated factor with chronic disease as opposed to a causative factor, and low levels are linked to higher cardiovascular morbidity and mortality. Lack of folate during pregnancy can lead to neural tube defects. And a study done in Switzerland comparing the nutrient deficiencies in plant-based diet as opposed to omnivorous diets or Western diets showed that 50% of omnivores had a deficiency in folate. Now this shows it's a trace nutrient, so it's only needed in small amounts, yet we're not getting those amounts. And it's usually found in green leafy vegetables, legumes, whole grains, as well as other fruits and vegetables. I often see patients where a low folate is found and the GP puts the patient on folic supplements. There's no conversation about diet, and we should have a food first approach. Once they finish those folate supplements, if the diet is not addressed, then the folate levels go down again and you tend to feel tired, and it affects other conditions and symptoms. So case 5 is a female in her 30s with mild depression and is on sertraline. She's been fatigued since she was a teenager and her symptoms are cyclical. She has irregular and heavy periods. She has unrefreshing sleep, but no brain fog. And she's able to walk and run for an hour each day and is weight training, so no post-exertional malaise. She hasn't had any talking therapies and has a ferritin of 11.8. We want to aim for a level above 40 in order to feel less tired. She's on a standard Western diet. So this patient has polycystic ovarian syndrome. And I was just going to mention that there is no dietary pattern that has been proven to be more effective in polycystic ovarian syndrome, but it's wrongly thought to be a period disorder per se, and it's actually a hormonal condition. There aren't any cysts in PCOS. In fact, what we're seeing on ultrasound are immature follicles that have been arrested in development, and they have this pearl string appearance. PCOS often goes undiagnosed because the examination, the scans are very observer dependent. And it's linked to insulin resistance. So, you know, there's a risk of diabetes. So men that are that have a female relative, a sister or a mother with polycystic ovarian syndrome are more at risk of diabetes. 20% of PCOS sufferers are of a normal BMI, but scans show increased visceral fat. And visceral fat is a type of fat that lines our cells and actually causes inflammation. And that's why in certain ethnicities where there's thrifty genes, such as South Asians, our aim for waist circumference is much lower because they increase propensity to have visceral fat. A really, really good book written by Rohini and also her mother, Dr. Neetu Bajekal, is Living PCOS Free, and it's really, really helpful. So let's talk about iron. So iron is actually a mineral that's normally found in the soil, and the way animals get it is from eating grass that's grown in the soil. And there are two types of iron. There's heme iron and non-heme iron. Heme iron is generally from animal-based sources, and non-heme iron is from plant-based sources. Now, the body has a sweet mechanism of absorbing iron. It knows that when the iron levels are low, such as when a woman is menstruating, that let's get more from the diet. It can do that effectively with a plant-based diet, but not with an animal-based diet. Eating more heme iron sources goes above our body's coping mechanisms, and you absorb it even if your levels are adequate. And the body has no way of actually eliminating it other than blood loss. So heme iron has been linked to harmful effects such as greater risk of some cancers, heart disease, and diabetes. Now, it's generally found in whole grains, legumes, and green leafy vegetables. And often, as doctors, we normally say, have orange juice with your iron supplements, but actually there are other ways of increasing its absorption. So any food with vitamin C increases the absorption of non-heme iron. So that could be bell peppers, citrus fruits, strawberries, for example, and even things like broccoli has it, and potatoes. It doesn't have to be at that meal then, but it can be alongside, such as if you have strawberries for dessert afterwards. It's important not to have tea or coffee or wine with your meals because it decreases the absorption, and really important not to just stick to spinach because beet greens, I think I've got that wrong, but the absorption, because of the oxalates and phytates in spinach, the iron from it is not absorbed as well. So it's really, really important just to have a variety of foods high in iron. So a study showed that omnivores had a higher prevalence of obesity, higher ferritin levels, and a lower prevalence of iron deficiency. But as I said, we don't want that. After the exclusion of individuals with inflammation, because ferritin is an acute phase reactant, when someone's ill with an infection, we have to check it again when they're better. The actual iron deficiency was not high among vegetarians, except in women with regular menstrual cycles. Now, if a woman I see both omnivorous women and vegetarian women, and if they're menstruating, it's quite hard to catch up with the diet. So I always advise a iron supplement, something like ferrous fumarate, which can be taken every other day because of the way the body absorbs it. But if a patient is likely to forget, then take it every day and hedge your bets that you'll remember to take it. Again, with the vitamin C source. And if levels are above 40 or close to 40 and patient still has the 3 cardinal symptoms of CFS, I will go on and make the diagnosis. We see this association, and I don't know, what the exact figures are, but between polycystic ovarian syndrome, IBS, POTS, and CFS as well. In the Swiss study that I mentioned earlier, the prevalence of iron deficiency was comparable across all diet groups. So let's talk about vitamin B12. So B12 is required for the development, myelination, and function of the central nervous system. People think animal foods as being high in B12, but actually, again, the original source is a plant is from soil bacteria. If you're on a plant-based diet, it's really important that you do take a B12 supplement, especially if you're going to be on one for more than 3 months. And I put that on my letters all the time when I'm encouraging a plant-based diet. The usual recommendations are 10 micrograms, but there are certain conditions where you want to have 25 micrograms. So it's best to go on the higher dose, or 1,000 micrograms twice weekly. In the Swiss study, it showed that there was no deficiency in all the groups, and that's because of supplementation. And as you saw with my patient case studies, is that most people are adequately supplemented on B12. Doctors are quite hot on that, but not usually on iron and folate, unfortunately. Absorption also decreases above the age of 50 because B12 is bound to protein, and with certain medications, such as if you are on metformin or omeprazole, or conditions such as untreated celiac disease. So B12 is not just a problem of people on plant-based diets, it can be a problem with everybody. And if the animals get the B12 from eating the soil, eating grass from the soil, but if animal is corn-fed, they're going to get it in a supplement anyway, and how much you absorb it secondhand is variable. So it's really important that everybody does get a B12 level done. If it's normal, then check it every 2 years, but if it's abnormal, replace and check every year. So this is showing the common nutrient deficiencies found in a study called the NUVA study, and it shows that the more towards a Western style type of diet, there's a higher excretion of selenium, iron, which I mentioned before we don't want, iodine and zinc. but there is an association with a higher body weight, BMI, and body fat percentage, which we know is pro-inflammatory. And there's an increased intake of total calories. The more you go towards a plant-based diet, there's decreased consumption of saturated fat and cholesterol, decreased sugar content in the diet, and increased intake of dietary fiber, beta carotene, vitamin E, K, folate, and vitamin C, and highest concentrations of, I've repeated that, so I apologize for that bit. So micronutrients are the nutrients that we need in trace or small amounts. And often we focus on the macronutrients, which is protein, especially, that we focus on a lot, which is a myth, carbohydrates and fat. But actually, often, when we're lacking in micronutrients, our body has this mechanism to eat more food in order to get them. And there's this term that we're overfed but undernourished. So typical micronutrients that we need to take care of are things like potassium. Potassium is found abundantly in so many plant-based foods, including legumes and green leafy vegetables. Yet when I hear GP consultations, and I was prone to this, is to say when a patient's lacking in potassium, eat a banana. There are so many more sources than that. And often conditions that could have been prevented, such as heart disease, from eating these potassium-rich foods. The potassium deficiency is exacerbated by the medications that treat it, such as furosemide for heart failure. Selenium is an important micronutrient which is found in the soil. Lack of it can cause hypothyroidism and hence fatigue. Good sources are Brazil nuts, and actually eating one Brazil nut a day usually gives you the recommended daily allowance that both men and women need. Iodine. I mentioned it earlier, iodine is a trace nutrient that is needed for good thyroid health. We don't get enough of it even in omnivorous diets and also vegan diets as well. Sea vegetables are a source, but people don't tend to eat lots of seaweed all throughout the week. So you could take a supplement of 140 micrograms a day. In places like America, salt is iodized, but it's not done so in the UK. Also, zinc is really important, is good for good skin health, fatigue, hair as well. And good food sources are tempeh, tahini, oatmeal, pumpkin, and sunflower seeds. Now, you're not going to remember this all, but what I say is that if you eat a variety of plant foods throughout the day, you're going to meet your micronutrient needs. Now, when people think of calcium, they think automatically of dairy. Now, that's a bit of a myth because we have the highest intake of dairy in westernized countries, yet it doesn't protect us from osteoporosis, and we have higher levels of that compared to other countries. Actually, plant-based sources are absorbed far more readily than the calcium in dairy. It's important to note that other factors are involved in the absorption of calcium. So you have to have good vitamin D levels. It doesn't matter if you're consuming enough calcium. If you're not having enough vitamin D and supplementing that, then you won't absorb the calcium from your diet. Good plant-based sources are calcium-set tofu, fortified plant milks, and green leafy vegetables and legumes. And again, important not to have tea and coffee with your meals to decrease the absorption. Weight-bearing exercise is really important in preventing osteoporosis. And obviously, we all know that calcium is good for healthy bones and teeth. Magnesium is needed for all sorts of reactions in the body and can affect fatigue. Good sources are whole wheat bread, almonds, spinach, black beans, and avocado. And vitamin C, I've mentioned it briefly earlier, it's water soluble and it must come from the diet. And it's an antioxidant and it helps the absorption of iron. It's only found in plant sources such as citrus foods, bell peppers, broccoli. So the key takeaways from this talk is that there are a diverse range of contributing factors to fatigue. Whole food plant-based diets are increasingly recommended for their wide-ranging health benefits, and that's been reported in the NUVA study that I mentioned and the Swiss study that I mentioned as well. All dietary patterns, not just whole food plant-based ones, need to be well planned. And the current medical model takes a reductionist approach rather than a holistic approach. Now, I know it's really difficult because resources are limited. You know, I'm a GP and I know in a 10-minute consultation, you're not going to achieve much. But it's just important to note that lifestyle histories reveal so much, and just asking, you know, what did you eat yesterday? What time did you go to bed is really, really important. Although we can't treat everything in one consultation, sowing the seeds can be helpful. So, you know, saying that, look, I give you some resources that could help with your diabetes. Why don't we discuss it at our next telephone review, can be very, very beneficial, because often, you know, we're lucky that we have a holistic approach to chronic fatigue syndrome, but a lot of other conditions such as heart disease, there's very little support in terms of lifestyle factors. Fatigue has huge impacts on an individual, and conversations around it need to be compassionate and supportive. Often patients, you know, we have the luxury of time, we have an hour per patient, and, you know, patients really value being heard, but it, you know, I get it, everyone doesn't have that luxury, but it's just really important to say, look, I understand how you're feeling, it's not your fault, but I can give you the advice and evidence to help support that. Obviously, not everybody is going to take that away, but I always say that I would be remiss if I didn't give you the evidence. What you do with that is up to you. So tips for incorporating more plants is that it's not an all or nothing approach. Having more sustainable changes, such as changing your breakfast every day for months, is better than going completely whole food plant-based for 2 weeks. So start with simple swaps, such as, you know, a patient will say to me, I had butter on toast, why don't we have, you know, avocado on toast instead, or hummus and red pepper is an example. Having a source of protein in the morning, such as tempeh, a cube of tempeh tofu, can help morning fatigue, and having a carbohydrate-rich meal, such as pasta, can help aid sleep at night. It's important to take shortcuts. I'm a busy mom too, so I don't have time to be sitting there making an hour elaborate meal. So I use things like an Instapot. I will turn it on and then go upstairs and work, or using lots of frozen foods and tin foods. And often frozen fruits and vegetables are far more fresh than actual fresh fruits and veg. And it's really important to go slowly. Our gut is like a muscle. It's like if you decided to run a marathon, you're not going to decide on Monday and then run it on Tuesday. You're going to take things slowly. So our our gut microbiome may not be ready for this high level of fiber. So going slowly and adding things and incorporating things is much more useful, and means that it can stick long term. Some really, really helpful resources are the Sailors Fatigue Foundation. They have really bite-sized information on their website and their Instagram page. Mr. Cookfulness, Ian Taverner, is a really, really lovely guy who's got fibromyalgia, and despite his level of disability, he's showing people that, you know, let's get cooking, and these are all the benefits you can get from whole plant food. So really do follow him, and he's available for talks, and has appeared in many magazines as well. And I've used the resources from plant-based health professionals. I often tell patients about the free leaflets on there for all the conditions, and also the micronutrient section is really, really helpful. And you can look at things that need addressing in plant-based diets. And their 21-day health challenge can help people go help them take the steps to go towards a more whole food plant-based diet. So just a quick thing about my story. So about 6 years ago, I became the most unhealthiest I think I was. I just had my second child. I was tired all the time. I had IBS symptoms. I was very anxious. I had a high BMI, close to 30, recurrent migraines, and recurrent urine infections as well. I was hoping to find a cause. I was hoping that, look, I hope my thyroid is off, so it explains everything. But unfortunately, nothing was found. I was referred for an MRI scan. I had a colonoscopy. I had tests for the urine symptoms, and nothing was found. No one mentioned my diet. And I just came across Veg Pledge about 5 years ago, and I thought, okay, if cancer research are backing this, there must be something in it. So I started following unbeknownst to me, a whole food plant-based diet, I lost about 15 kilos. I dropped 3 dress sizes. But the most important thing is that I stopped focusing on the outside health. It wasn't the yo-yo diet, you know, the milkshakes, the tablets to lose weight, the keto diet, which I tried as well. But actually, I focused on the inside, adding the whole plant foods, and all my symptoms got better. And that's why I'm a passionate advocate for this type of living. And I've helped so many patients and also my own relatives get better and get remission from their conditions. I would really, really love you to follow me on Instagram, where I have lots of tips and free recipes. I also do lifestyle coaching privately as well. And I have a website coming out soon. So I hope that was helpful, and yeah, ready for any questions.
That was wonderful, Tila. I don't know I think let me just stop the slide there. Wonderful. Hopefully everyone's taking a picture of that. That was brilliant. I learned so much. It's such a huge topic, and I think you covered so many different aspects so well, and just kind of piqued our mind and kind of made us think outside the box a little bit with how so many different conditions can be related to fatigue and what the actual definitions are, because sometimes these terms get used and we're not exactly sure what the criteria are. I certainly wasn't aware, so it was really, really helpful. And someone who had to leave early also wanted to thank you and say, you know, what an inspiring story. And they have to leave, but they want to thank you for this really insightful and useful talk. So thank you. And I really enjoyed hearing your personal story at the end. I think it's really powerful when health professionals share their own stories and connect to their patients.
Thank you.
So let's dive into the questions. We already have a few questions here that I think will be good fun to kind of tackle. So one of the questions that came up is, what about a whole food plant-based eater who feels tired often and their B12 blood levels are adequate? What do you think is the cause of that? Huge question.
It's very difficult to say, because like I said, you know, it's everything. We have to take a holistic look at the whole picture. It's not just the thing about diet. We have to look at other factors. And even myself, you know, I had to go to therapy and address my mood, and often there's so many factors that interplay. So, you know, if you can discuss it with your doctor, if you do think that you identify with the cardinal symptoms, then important to ask to be referred to a chronic fatigue syndrome service. But you know, I'm hoping this kind of gives a spur about thinking about what the different causes could be.
No, I totally agree with you. And there are so many different questions that people have posed that actually require individual medical advice, which we're unfortunately not able to give here. If you need a really thorough assessment, there are so many different parts of the puzzle, as we already learned in this webinar. And you know, B12 is just one metric. There's vitamin D, thyroid, so many, you know, mental issues, so many other aspects that need to be considered. So someone's asked kind of how they could get in touch with you, and if you could share the last slide again. A few people have asked for that, just because I think you obviously do private coaching as well, don't you, Tila?
Yeah, I do. So happy to, obviously I can't take the place of someone's doctor and do blood tests and things like that, but I can certainly help, you know, alongside to help with the lifestyle factors. And often, you know, like I said, they don't have to be mutually exclusive.
Yeah, wonderful. I totally agree. And I think for anyone who's wanting that individual advice, then there's no replacement or substitute for having that, you know, that person to look over everything and all your results and kind of that individual coaching as well. So I'm afraid that we can't get into some of those questions right now. So one of the other questions touched on the role of raw food diets for chronic fatigue syndrome. And obviously that's come up several times in the context of plant-based diets and autoimmune conditions, where you do see online several people talking about plant-based diets and raw food diets specifically for autoimmune conditions. Have you come across any literature around that for chronic fatigue syndrome, or do you have any thoughts about raw food vegan diets for that?
So I mentioned this study in terms of fibromyalgia. It was quite a small study which showed improvement in symptoms. Obviously, it's quite subjective as well. Look, we have, it's really important that we do have a lot of raw plant foods in our diet because of their health benefits. But I'm not and people have shown, you know, good health stories on raw food diets, but I'm not a believer in doing the extreme long term, because we talked about the diversity of the microbiome, and certain foods are better cooked, such as tomatoes produce more lycopene when they're cooked compared to raw foods. So I think it's important to have a mixture of foods, have a lot of raw foods, because certain foods are best eaten raw, like broccoli, for example. But it's really important not to have a very extreme approach. Whatever you do needs to be sustainable. And just to note that raw vegan diets aren't suitable for children because of the high fiber content.
Yeah, I totally agree. I think that they do restrict some really valuable foods in there, like a lot of, you know, beans and things like that.
Sweet potatoes as well.
Exactly, and grains. I think that they can be quite restrictive. I think that they can be difficult to follow, obviously socially and otherwise. And in the UK, our climate isn't necessarily totally conducive compared to, say, living in Bali or something, where I think it would be a lot easier with all the amazing kind of produce that's available. But that's just my thoughts. I think that, you know, if it's working for you, there's a great book by Brenda Davis called Becoming Raw, which has some good guidance on how to do it in a way that's safer and kind of more nutritious, and just take into account some of those nutrients that may be harder to get. But I think it's something that would be something that probably, you know, isn't a top of mind recommendation.
We have to be practical though as well, because, you know, not all of us, if you're fatigued, you haven't got time to be sitting there chewing greens. And often, you know, you get a massive bag of spinach. If you cook it down, it turns into this much. Okay, some of the nutrients might go, but having some is better than none. So, you know, we have to be pragmatic about things. Although, you know, I'm thinking more and more about sprouting legumes, because that increases the iron content. But it's just really important to have a diverse range of plants. Don't be bogged down by the minutiae. I don't worry about, oh, I have to have organic, or I have to have completely raw. Just eat plants. That's all I'm trying to promote, and that's why I'm called the plant promoting doctor.
Yeah, I couldn't agree more. Okay, I'm just going to close that screen so everyone can see us a little bit better now. Do you have any thoughts on the role of CoQ10, that's coenzyme Q10, and L-thyrronine? I think that's what you meant, L-thyrronine.
To be honest with you, I've seen a couple of patients that have supplemented on that. As again, we've said that there's a reductionist approach doesn't work when we just focus on one aspect, taking one supplement, but not looking at the overall lifestyle. And that's usually what I find with gluten-free diets as well. I respect patients that say that going gluten-free is helpful, but, you know, if it was the be all and end all, you wouldn't be seeing me in clinic. So it's really, really important to look at all the lifestyle factors and not get too bogged down by the minutiae. But I get the need to have something that works, and I really, really get that, and I sympathize with that.
Totally. Do you, what if there is no chronic fatigue syndrome service nearby? Often patients are doing the rounds in psychology, endocrinology, rheumatology, gastroenterology, and where is best to start if, you know, that's the situation?
So I often say we don't see a lot of patients with actual CFS. We get a lot of referrals of patients with other causes of fatigue, as I highlighted. And I often say that, look, I understand that there's this feeling of like, finally, I'm seeing a service which will help me. And unfortunately, we can't help everyone. But there are ways of you getting this holistic help in other ways. And our aim is to get you better, not how we get you better. So like I said, start with the food first, start with the fuel. And the fuel is not just the food, but also I would say mental well-being comes into that as well. So you can access talking therapies through the NHS or privately. And in terms of diet, there are lots of free resources, like we mentioned, plant-based health professionals, yourself, Rohini. So, you know, my page as well, and PCRM. So lots of health challenges to help with those aspects. And often, you know, a lot of the lifestyle doctors have advice about sleep and other aspects of chronic fatigue.
Couldn't agree more. Yeah, plant-based health professionals, we have an amazing 21-day health challenge, which is totally free, with lots of recipes and tips in there, but also lots of fact sheets on other kind of coexisting conditions that it may be helpful to look at, whether it's diabetes or PCOS or heart disease. Is there any evidence linking Hashimoto's and chronic fatigue syndrome?
Not that I found, but that's interesting. I will see if I can find anything and let you know, Rohini.
Yeah, there's also a question about chronic fatigue and dementia. I imagine that we have a paucity of research in the area of chronic fatigue, as you mentioned, that there probably isn't any. But I wondered if you know if there's anything between chronic fatigue and dementia.
So dementia, we know largely is a cardiovascular disease, like cardiovascular risk factors affect dementia. And often people think about the rare cause, which is the ApoE4 allele, the genetic cause, but that only counts for about 3% of dementia. So, you know, paying attention to the lifestyle factors and your risk of cardiovascular disease can help prevent dementia. But dementia can present with fatigue. I don't know about the link of chronic fatigue syndrome and dementia, but technically speaking, CFS is a diagnosis of exclusion. So I don't think you could have dementia as well as CFS.
Really interesting kind of question about, well, it comes up and it's a bit tangential to this, but it's about whether flaxseed is safe to take for someone who has fibroids and hoping to shrink them. And again, that kind of touches on soya, flaxseeds, obviously these foods that are rich in phytoestrogens. What are your thoughts about the safety of these foods?
Like you and your mom are like raving about, is that soya is good for you. Don't be scared of soya. So we have anecdotal evidence of someone who was drinking liters and liters of soya milk and then got gynecomastia and harmful effects. But most of us aren't doing that. So in Southeast Asia, where there's a high consumption of soya products, there is a lower incidence, or there was a lower incidence before westernization of diets of certain conditions, such as reporting of menopausal symptoms, breast cancer, prostate cancer. So, you know, including 1 portion of soya a day is really beneficial. And I'll give my mum an example. Her hot flushes have just totally decreased. And she drinks soya milk all the time.
Depending on kind of your body weight and so on, you know, up to 4 portions a day. I have 2 to 3 portions a day personally.
Yeah.
And when it comes to flaxseed, you know, it's fantastic for improving hormonal sensitivity. It's rich in fiber, it's rich in other micronutrients, obviously rich in lignans. So yeah, please don't be worried about flax seeds and things. And for fibroids, there's a great fact sheet on drnitubajekal.com/fibroids, so you can go and check that out. Is it best to do the iron studies, ferritin blood on an empty stomach, and avoid iron sources and or supplements for a couple of days beforehand, or is there no need?
I think there's no need. I think it's important to know what your iron status is on the supplement that you're taking. So that's important, but it's really important that you don't supplement without checking levels, because you can overdose on iron and there's harmful effects of doing that. So really important you check it. And obviously don't assume it's a dietary cause, because iron can commonly be because of blood loss. Especially in older people, we have to worry about sinister causes. So really, really important that you talk to your doctor.
Wonderful. I just realized I've gone a few minutes over time. So thank you everyone for bearing with me. I'm just going to launch the questionnaire now. And thank you so much for sticking around, those who did. And there's just so many great questions. And there's questions about insulin resistance that we didn't come to, but there's lots of information again at Plant-Based Health Professionals. Lots of questions about, you know, individual questions that unfortunately can't be answered, but do contact Tila if you would like individual guidance, and you know, visit her website for more tips and things and so on. And thank you everyone for joining, and please do join us in a couple of weeks' time for the Plant-Based Athlete, because that's going to be, again, fantastic with a registered dietitian, lots of nutrition tips in there. Lovely comments for you, Tila. Excellent, very informative, great talk. Thanks so much. great presentation. Thank you for hosting great webinars. There's a lack of understanding of the conditions you cover amongst public and medical professionals in general. Thank you, Tila, for showing so much compassion, authenticity, and kindness. Wow, that's wonderful. So lovely. So
Thank
many
you.
messages.
I wish I could get this on my appraisal.
Well, yeah, I've saved the chat for you, so I'll make sure I send that to you. Thank you for joining, and good night. And thank you again for being here.
Thank you.